Welcome to the Whiskey and Wisdom Podcast, coming to you from the Cargo District Recording Studios in Wilmington, North Carolina, where we discuss the most fascinating topics of life. I'm Tyler Yaw with my co-host, Chris Keller, and each week we interview a special guest to learn how they acquired their wisdom over a glass of whiskey. So, sit back, pour yourself a glass, and enjoy Whiskey and Wisdom.
Welcome back to the Whiskey and Wisdom Podcast. It is your constant co-host, Chris.
And Tyler, y'all.
This week we bring on our special guest.
This is Dr. Josh Dobstaff with Progress Medical.
Thanks so much for coming on today.
Yeah, thanks, guys. Thanks for having me.
Of course. Tyler's always like out in the world meeting new people.
Yeah.
And he's like, oh, this guy will be perfect. And I'm like, I'm here for it.
Yeah, no, that sounded like a perfect opportunity to sit down and chat, so I'm excited.
Definitely.
Nice. So before we go into the deep dive, we are drinking on some whiskey Tyler brought back from Virginia a couple weeks ago. It's the Discretion whiskey. Where is this? Tarnished Truth Distilling Company.
That's correct. Yeah, their Discretion is kind of like their flagship whiskey that they have coming out of there.
Interesting.
Yeah.
Yeah, it's super classic mash bill, 70% corn, 18% wheat, 12% malted barley. Should have like a classic dry oak, vanilla, some tobacco leaf, and green apple notes on the nose. And then taste, you should get your typical like wheated mash bill, butterscotch, honey, some caramel in there. So yeah.
Yeah, let's give it a shot.
Excited.
Cheers.
Cheers, guys. It's pretty smooth to me. You said this was Virginia Beach?
Virginia Beach. Mm-hmm.
Very
Virginia
interesting.
Beach.
So my wife, Jennifer, actually really liked this Discretion, and she's not really a whiskey drinker.
Yeah.
So that said a lot.
Yeah.
I really like the other one that we had a couple weeks ago, which is the Tarnished Truth 3-year high rye.
Yeah.
That one's one of my favorites, but I like the spiciness of the rye a little bit more. but this one's a really good one, and evidently for people who don't like whiskey, it's not a bad one.
That's a big win if your wife's drinking it. Yeah.
Exactly.
Yes. She's a little particular.
Yeah, that's the nice way of saying it.
If I'm spending money on something, I expect to be particular about it.
That's very true.
Mm-hmm.
But Doc, tell us a little bit about yourself.
Yeah. So, my name is Dr. Dobstaff. So I started Progress Medical here in Wilmington. So this kind of was sort of a culmination of kind of many years of putting together some ideas of what I would want my own kind of practice to look like. I've been in practice for almost 15 years, all across the state. I've done quite a few different things. Largely, a big portion of my career was in hospitals. So, that's where some of my foundation was. My background is internal medicine, which is more of a traditional route, right? But, as I was going along and, in different hospitals, and I'm a medical director in a few different clinics across the state, really, I kind of got a blend of different things and some different ideas and brought all those together to bring it back to Wilmington to see what my own practice would really look like. And really what that is to me is a blend of sort of a traditional medical practice, and bringing in some things that we would call maybe more functional concepts. Maybe you all have heard of functional medicine. Have you really? Okay.
Yeah,
good.
we brought on a doctor, Dr. Hillary Rutledge, who has a functional medical practice.
Yes, great. Good. So you've got a good kind of background. And I think I actually absolutely love the functional piece because it's a little bit of a deeper dive, right? I mean, it's kind of, internal medicine is great. I mean, that really looks at all aspects of the body and very good detail and everything. It's just, I keep saying traditional when I talk about internal medicine, and that's a good way to describe it because that's the typical doctor that you think of when you go to them.
Right.
I'm not really interested necessarily in being that typical doctor, but I'm not a full-fledged functional doc either. But I feel like why not blend them both together?
Yeah,
right? I mean, it kind of makes the most sense because I think there are some areas where internal medicine is maybe lacking, or the family medicine route, those short visits where you maybe feel like you're not getting that deep dive and maybe not getting the attention. So when we look at functional things, we can go into a sort of a different direction, which I thought was really great and wanted to bring that together, blend them together, and then, see what we could come up with. So as a brief kind of overview of what I do, there is some, sort of what I would call primary care, which blends those concepts together. I felt like that was a good foundational piece. But then really have gotten a lot of good experience and knowledge on hormone optimization, which I think is an underutilized thing, especially on the traditional side.
Right.
Medical weight loss is kind of a big thing right now. And so those two go very well together. But we do kind of do them either separately or together, depending on what the patient needs. And then I've been very much into, I've always kind of been an athlete throughout my life, and I love the idea of sort of not only optimizing hormones, but performance. And so bringing in some more like IV hydrational things, replenishment, kind of getting into those custom things where we can really make people feel good as soon as they're leaving the office. Got me really excited. Right. So started kind of putting together all these little concepts, and that's kind of how Progress Medical came to be.
So when you were in the hospitals, what were you doing in the hospitals?
So initially it's called a hospitalist. So it's kind of like a hospitalist is kind of like your primary care physician while you're in the hospital. You can think about it that way. So I'm the guy that would go and admit you from the emergency room, get you upstairs. We would see you every day, round on you, call a specialist if we needed to. And then whenever you were discharged, you would go back and see your regular doctor.
Oh, okay.
So there was, that was fine, but COVID changed that.
Sure, yeah.
Kind of saw a lot of different things. I was working in a hospital in the mountains at the time, and it was a very, very small hospital. And then we had to sort of turn into a, ICU-based hospital with limited resources and ability to transfer really sick patients out. So that was an interesting experience. And, all providers and doctors, especially hospitalist doctors, I think really kind of got philosophical maybe and questioned, what the right approach was for them in terms of their career. And for me, I was already thinking about what might be different. And then this sort of, COVID kind of just expedited that sort of transition for me.
Yeah. Where did the first kind of inkling of, I might want to look into more of this like functional realm of medicine before you started kind of combining them both together?
Really, when I got into hormone optimization, because when I started learning more and more about that, and, like when I talk about hormone replacement, I'm talking about testosterone, estrogen, thyroid hormone, things like that. And, it really kind of opened my eyes about, how a lot of the symptoms for men and women who are kind of hitting their mid 30s to, beyond, how much of it could, a keyword is could, be a related to, lack of hormones. And so, when you think about cardiovascular risks and cancer risks and all these things, why are we so tired when we hit 35 and 40? Right. And is it just a menopausal thing for women? But the answer is really no. I mean, women need testosterone too. That's a big sort of misconception. And so, part of the reason why they may not be feeling good is because their testosterone is not optimized. In fact, by the time they're 40, their testosterone levels have dropped by at least 50% compared to when they were in their 30s. And so that's sort of a key consideration and something that we talk a lot about when we're talking about hormones. And so it really opened my eyes because there's different ways to test for these, hormones, and then it kind of gets you down this path where it really is more of that functional process, and then you can do a much deeper dive when you're doing those things, and looking into those things, and it's just kind of expanded really from there.
Right. So with your practice, is it more of like that family general practice, or is it?
Honestly, no, I wouldn't say that. I mean, I do some kind of foundational primary care concepts. I have much more of like a concierge type of primary care, which is more of like you pay a sort of a subscription fee to have, access to me and my team. And we try to make it a 24/7 thing. So if you've got an issue at 11 o'clock, you kind of can call us and we're either getting you in the next day or saying, maybe we need to do something else right away, that kind of thing. So I do think all of these sort of functional concepts really boil down to good primary care. Right. And then as people, start naming, they need some sort of, recovery type things, we have all sorts of things. And, even aesthetics. I mean, so we've kind of branched out into different things to see. So, but that is a kind of a common question I get is like, what is your actual practice as a primary care? Is it the other things? And I really kind of consider it a good conglomerate of all those things. Foundational primary care. We can branch off into other areas if we need to.
Okay, nice.
So like looking at your website, his office is so much more casual feeling. Like it's not as sterile as like walking into like a traditional hospital or a normal doctor's office. It definitely has that concierge feeling where you feel at home and you don't feel like
that was really kind of the idea.
Yeah.
I mean, it was the hope is that you weren't gonna walk in and it was gonna, smell doctory and look very, I don't know, too sterile, like you said. And, we tried to figure out a way to make it much more comfortable appearing. So credit to my wife, Lisa, for that. She did all the design aspects of it. And, we're still making tweaks and, trying to make it so everybody, you walk in and you don't feel like you're walking into a doctor's office, even though you're still going to get good care.
Right.
Yeah. Yeah. That's the random things I pull up and look at. I'm like, that actually gives me one, guys hate going to the doctor in general.
Yeah.
I'm sure you've noticed that.
Yeah.
But making it so it feels like, I'm still at home, or it's something a little bit more casual.
Yeah.
I feel like I'd be way more comfortable showing up to a doctor's appointment like that.
And you're not going to feel rushed. It's not like, there's other, we have people, we have a relatively smaller waiting room, I guess, compared to other, doctor's offices, but, you're not going to feel like we're just ushering you in, ushering you out kind of thing. That was never the goal. So like when I really kind of thought through what I wanted this to be like, it didn't want to be like that. If we're talking about anything traditional, which again has some value, it wasn't going to be that quick, you got 15 minutes and maybe feel like you got nothing accomplished kind of visit. So we're trying to do something a little different.
Interesting. My random thought process. It says that you have in-mode therapy.
Yes. Yep. So that's more on the aesthetic side of things. So, and the reason we got into a little bit of aesthetics is because we were getting really good results with the hormones and weight loss. And so as you do that, then, things are a little bit maybe saggy or thinner and things like that. So we've got some good options for sort of like, whether it's face or body, things that can tighten up the skin and wrinkles and even some fat. So like, InMode is a well-known company that provides some of these machines, and I don't know, you guys may not have heard of it. There's something called Morpheus 8. And so in this aesthetic world, if you look it up, it's actually a very popular thing to use, a technique to use for what we're talking about. So usually what that is, it actually does microneedling into the skin, and when it's in the skin, it emits a radio frequency, sort of like heat, which damages the underlying area just underneath the skin, including the collagen. So it almost like induced damage in a controlled fashion that as it heals, sort of tones up and tightens the skin, reducing fine lines and wrinkles, and you can even target fat areas as well. So you can do that on the face, you can even do that on the body, goes very deep into the tissue and can coagulate fat. So we actually get really good results. Goes very well with our, weight loss option, like I said, or even somebody that wants to just try general body contouring. So that's the Morpheus is probably one of the more popular products we have. We also have like a laser hair removal option and something. Have you guys ever heard of cool sculpting?
Yeah.
So it's actually the opposite. So cool sculpting uses cooling to kind of freeze fat, and then it leads to sort of an inflammatory response that shrinks. Theoretically, this uses heat and then emits a radio frequency under the skin to heat that area, which again does sort of a similar thing, causing a reduction in fat underneath the skin. So
is that what the medical weight loss is?
So no, not really. That's sort of an adjunct or a supplement to the medical weight loss. Okay. So the weight loss is usually more of a medication-based thing to try and really achieve good weight loss results. And so maybe you guys have heard of like Ozempic and Wegovy. That's sort of the popular injection type medication now. The generic name is called semaglutide, and that's typically what I end up prescribing. And we get really good results with that. So there's other options, but really most people come in looking for that. And so it's a once-a-week injection. Usually you're talking about on average 15% weight loss, which is really good. And there's always new things coming out, new injections, a lot of things, that we're keeping an eye out for, whether pills or other injections. And so we just found people really get great results. Like I said earlier, it goes hand in hand with hormone optimization, because I like to tell people, I can't really, it's hard to optimize your weight if I haven't optimized your hormones too, because a lot of the reasons why you may be having sort of that stubborn weight gain or really difficulty losing weight as we age, which, if you're 30s, late 30s, 40s, then everybody's really experienced that, right? Then, part of that could be a hormone-based thing. So I try and, when I'm doing a weight loss evaluation, which is an extensive sort of lab panel, it usually includes hormones to at least say, this may be contributing. And then we can have a conversation about, really developing a customized, tailored treatment plan for you that really, dials into what your body's needs are.
I've heard a lot about the Ozempic and stuff too. And my question I've always had, and it's probably different for you than most other people, I would assume, is when I think of what the media is telling you about Ozempic, it sounds like you walk into a medical professional place and they're like, we're going to give you this shot and you're going to magically lose this weight.
Right.
But they're not telling you to do any of the other things that are involved with it.
Yeah, good. I'm glad you said that, because, and that's really an important thing. I don't want anybody coming in thinking they're just going to get this. And even though technically, if you just did it, I'm hesitant even to say that you can lose weight, because you will.
Right.
The point and the goal is to have a long-lasting effect. We don't want to lose the weight and then gain it back, which has actually been shown. If you just do the injections, then go off the injections, you are likely to gain it right back. So what the program is designed to do while you're on the injections, you combine that with the right diet and exercise programs, which build those healthier lifestyle habits while maintaining and reaching that weight that you really want. And then as we hit that goal weight, then we start trying to figure out, can we get you off this medication? Some people talk about being on it for life. I don't really personally agree with that. I think it can take longer for some. It can be a relatively shorter process. It just depends. But it's customized. And, so once we get to that maintenance phase or even trying to wean off, then we have it structured in the right way. So, because there's reports that, even say, you may be when you're losing weight, you may actually be losing more muscle than fat, which I haven't looked into, I haven't verified, but anytime you're losing weight quickly, you're going to lose. It's not always going to be just fat. Anybody who loses weight, it's never going to be, just 100% fat. It would be lovely if it was, but it's not the case. And so we got to be really careful with, monitoring those things and making sure we're maintaining muscle through a structured exercise program in order to make sure that that kind of thing isn't happening.
Right.
So, it's not without, side effects and risks. Nothing that I do is. No physician does anything without risks. So, we have to keep that in mind. That's why we do it under the supervision of myself and make sure that, it's as safe as possible.
Right.
But it's not for everybody. There are things that rule people out from taking it. And so that's an important consideration as well.
Yeah. So something that I know you've met Sarah Auld from Upper.
Yeah. Love Sarah. Yeah, absolutely.
She's great. Something that we've talked about in the past is there's a lack of men in the functional holistic type of field. So anytime you look for functional medicine, it's almost all women.
Yeah,
my question to you, and I'm not sure if you even thought about this much, but why do you think that is? Why do you think men are more hesitant to take that more holistic from looking at hormone therapy down to what they're eating approach?
That's a great question. I guess I don't have a good answer. I think it boils down, and I'm not saying men are less open, but it does boil down to openness about the alternative options. There's plenty of female internists that really maybe aren't interested or don't have good education about hormones and what they can do, how we can supplement and help each other. But I agree. In the functional world, some of the groups I'm involved in here in Wilmington, it seems like we are dealing with more probably female base. I don't have a good answer for that. I wish, there was more. Like I said, I think it boils down to, us being more open about what people need. And I really think COVID changed that perspective and that dynamic and like that thought about what are we putting in our bodies and what is this treatment really? And maybe we don't really want to just take a pill or whatever it is, which is not what internal medicine is fully about. But at the same time, people started asking more questions, right? I mean, whether it was controversial and whether it was valid or not, that's a whole separate conversation. Right, But the point is, people were asking different questions. And I think this is the emerging aspect. This is the emerging field that internists need to take note and be aware of and be a little bit more open about. And so hopefully it's for any male or female MD or DO that, is seeing people ask more and more questions about some of these alternative therapies, to be like, not only like, no, don't do that. It's like, maybe, we keep getting these same questions. We start to have to ask ourselves, maybe there's some validity here. And a lot of these treatments are very well studied. So it's not like we're just kind of doing these fringe treatments or anything, right? So that's a really important consideration.
I was interested, like you say, in fringe treatment, and it makes me laugh because, like, for years, I feel like people looked at it and like these are fringe doctors. They're like, the treatments are prescribing are just like on the edge. Like, no one really talks about it. But I would say in the past, like 5 to 10 years, there's been more research. There's been proof to show that like these are things that are helping people and actually doing good work.
Absolutely. Yeah. I mean, if you look at hormones, hormone replacement has been studied since, like the first hormone pellet procedure was done in like the 1930s. Oh, wow. I mean, so there's hundreds of studies, kind of validating the benefits of hormone optimization. Again, nothing, it's not for everybody. Nothing truly is, but it's way more, like hormone deficiency and, who is a good candidate for hormone optimization is way more prevalent than people really realize. Yeah. And even myself, even just a few years ago when I first got involved in it and started learning more and more about it, it's fascinating. And so it's really not fringe. It's not something that is just us kind of, going rogue in a dark alley doing random things. It's like, this is a validated process. It really is.
Yeah. And I think you touched on something really important too, is just taking that time to find out who that person is. Because exactly what you said, like, it's not for everyone. Yeah. What a lot of traditional type of medicine you'll see is, hey, this one thing is for everyone. You come in here, you have this one symptom. We're going to treat that one symptom the way we treat everyone else with that one symptom. Yep. So I think you touched on something really important there, that it really is the individual themselves. I was even doing like research on like diets for individuals. And so just wherever your ancestors were from like hundreds of years ago makes a difference on what you can and can't tolerate.
Sure.
So like even down to that point. So just, making sure you find the right person that's willing to take that deep dive.
And it's, speaking of openness of doctors, it's really openness of patients too. Everybody has their own, brings their own perspective and needs and goals into the mix. And there's plenty that do want a pill, but there's a lot that don't. And, so when I do start evaluating a patient that wants to come in and see me as their primary care physician, my first question to them is, or the first approach is really trying to dial in where their philosophy is. Because I think as providers, we need to be a little bit more malleable, not say this is how it has to be. Right. You tell me where you fit into this, traditional, this functional, and then we're going to wrap it around and, kind of package this up into something that you can actually see some value in, and it kind of motivates them to go further. And, really, then we can kind of work together to develop treatment plans that they're going to really get behind,
Right, yeah. And just like anything in the world, if you're working together on something, you're probably more willing to stick with it, I would assume, right?
Yeah, that's been my kind of observation as we've gone through this, really. So
it's very, I think it's just interesting because it's so hard nowadays, like you said, to find a doctor who doesn't treat you like, oh, hey, you're here, check, hop out the door. And they're not getting that good, like, getting to know you treatment. And I think that's part of the reason why people aren't as open about what their issues are. They're like, okay, well, this is my current issue. That's what I'm here for, because you only got 10 minutes to see me.
Yeah, and if you, imagine if you had to do a podcast in 10 minutes. How would I feel for you, if, you kind of ushering me in, ushering me out, and me feeling like I have all this stuff to say. Yeah, right? But I can't say all this in 10 minutes. It's the same thing with somebody who's got, Maybe they do have a list of symptoms. Maybe they have something they really are struggling with, whether it's mental, emotional, physical, whatever it is. And it's like 10 minutes doesn't cut it. And, it's not like doctors are bad. They didn't go into this field for that to be rushed. I mean, there's a lot of factors. Again, that's a broader discussion, but there's a lot of factors involved in why those, maybe it's not 10 minutes, maybe it's 20, whatever it is, but it's still fast. And, whether it's insurance or, just the volume of patients. And so I got to be careful, I feel like, with, I almost am capping the number of patients that I'll see on a concierge primary care basis, because my first observation is going to be, can I deliver and not become that, right? Like how can I kind of keep it with that same vision in mind? And then what is it going to take to reach more and more people, whether it's more staff, or whatever it is, how can we do that? So it's going to be sort of an incremental process for me to get to that point. But obviously we want to help as many people as we can.
Absolutely.
I like that. So we're going back a little bit. You mentioned hormone therapy. Mm-hmm. So as a person who doesn't know much about anything, when I think of hormone therapy, I'm like, so you're doing like testosterone, TRT?
Yep. That's one aspect of it. Yeah.
Okay. So my question to you is, like, for a normal person, what are the other options? I know you mentioned a few. And what is that like? What do those things actually affect besides like your tiredness?
Yes. Well, I mean, so when we're talking about, when we're talking about hormone replacement, I mean, typically the big ones we're talking about is testosterone, estrogen for women, progesterone for women. Thyroid is a hormone. There's a lot of different ways to, replace that as well. But when we're talking about, just like, we'll start with testosterone, for example. So what happens is we kind of do a questionnaire and go through a process to identify, could all this be signs of, low testosterone? So, and it's not just a libido thing, although that's a big thing. Some people do come in and they talk about that, but quite honestly, they're coming in because I'm tired. I'm gaining weight. I got mental fogginess. Like, I just don't feel like things are clear anymore. I'm more moody. I feel like I'm getting more depressed, and these are all things that are just happening more and more as we age. And maybe there's other reasons for that. Of course there is, but how we respond to those stresses of life and everything really depend on how optimized we are physically. Right. And so these are all things. So there's probably about 20 different lists of symptoms, you'll see hair loss, joint pains, things like that, poor sleep quality. Like there's just a list that goes on, because there's really nothing in our bodies that testosterone for men and estrogen and progesterone for women doesn't touch. I mean, there's receptors for these hormones everywhere. And there's a really big component to that. And so you start to ask your question, like, why do people get heart attacks? And there's studies that show, testosterone, at certain levels is shown to reduce your risk of heart attacks and strokes, Alzheimer's disease, all these things that just everybody considers sort of this natural part of aging. It's not all hormones, it's not all testosterone, but there is a component of that has been clearly associated with it. That is an important consideration. So I think part of your question is then how do we replace those hormones? I'm not sure if that's what you're asking, but so there's a number of different ways that we do that. There's creams that you just kind of put on your body and it absorbs in. There's something called pellets, which is a small in-office minor surgical procedure. I wouldn't even call it a surgical procedure. It's just a 25-minute procedure where the pellets are inserted underneath the skin and they absorb into your system over time. So you only have to do a pellet procedure typically, I don't know, on average, we'll say 4 times a year, as opposed to doing a cream every day. And, some people talk about variable absorption and how it affects your levels. That's a whole different story. But those are the main things I do. And the reason I do those two is because they're what's called bioidentical hormones. So now there's 2 different types of hormones. I'm just going to keep diving into this. So there's bioidentical and there's synthetic. So synthetic is not fake, but it's made, kind of chemically, and it's not the exact structure as the testosterone that's in our bodies. Okay. Bioidentical means it's identical in chemical structure to what's in our bodies. So I encourage that. None of them are without potential for side effects. I mean, if you think about your hormone level getting too high, like high testosterone, acne, and mood goes the other way, and things like that. We're not shooting for that, of course. We kind of keep it conservative and go up. But when we do the bioidenticals, it really sort of is a cleaner process. And then the side effects with synthetics are a little bit different, so that we've seen. So there's plenty of people that do synthetics, and that's typically an injection into the muscle, once or twice a week. Some people do request that, and, I'm happy to do it as long as they understand that, it is a synthetic and it's a different side effect profile to it. And, kind of doing a lot of education about what the difference is between the two, benefits and risks of each one, and, really just kind of making sure they feel like they're making a good informed decision, really.
So the synthetics, is that what like the average person like me would think of, like a typical steroid that people take to like get ripped type of thing? Like,
it's not even like, you're thinking about like juicing and all that stuff.
Right. Yeah. Like an Arnold Schwarzenegger type of deal.
It's not even that. It's it's still testosterone. It's like, we call it like cypionate. It's all these different terms that are sort of like in an oil that you just kind of inject in your skin. It's still testosterone. Okay. It's just structured. The base is testosterone. There's some added kind of components to it that are a little bit different. And your body could sort of recognize that a little bit differently, and we see kind of different side effects as a result of that. So it's still testosterone, but again, I just always encourage the bioidenticals. But again, it's really up to the patient. So, and then, if we're talking about estrogen, that's also, we can do that as a pellet. There's a cream for that as well. There's other formulations for that. And so it's very common for women. So
is it harder to, because I know women need testosterone just on a much lower level than men. Yeah. Is that in the grand scheme, not trying to trip you up, but like in the grand scheme of things, like, is that harder to like dose a woman with testosterone than a man, because you have to like be more careful with the way that it's balanced or anything like that? Or
not necessarily. It's just much lower doses.
Okay.
I mean, for a pellet, for example, we're talking about like each pellet for a male is either 100 or 200 milligrams. And sometimes I'm putting in, 12 pellets. It could be.
Okay.
A woman may need one, it's just less dosing, and we're targeting different testosterone levels for a woman than a man. So clearly want that way, way down. But, still I've had plenty of women that, their testosterone levels are like undetectable, and that's not how it's supposed to be, but it's just, it happens, and they don't understand, and nobody tells them that, testosterone is just as important. In fact, by a concentration standpoint, testosterone is the most abundant hormone in a woman's body. More than estrogen or progesterone.
Oh, that's interesting.
Yeah, that's just really an educational piece. So it's just fun to talk about, and and then everybody's like, oh, okay, and then we go down that road, and if they are interested and it is appropriate for them, then they really do see a difference. And usually their husbands are happy too.
Right, I'm sure.
So transitioning, because I'm just going through all the stuff that you guys offer. I think it's fun because to me, I'm learning so much about stuff like I would have never thought about. So like, I didn't know pellets were a thing.
Right. Like
I said, for me as a normal person, the only thing when people are like, oh, hey, he got testosterone, it was just like, he walked in, had to get shots in his butt.
Yeah.
But this, I'm like, this seems more, like I said, concierge, better, easier for people to maintain. Like a pellet seems way easier. But also like the creams. I have heard of creams though.
Yeah.
I had no idea how they worked, but
there's people that don't want to do the pellets. Guys are hard actually to get them. They don't like, guys are harder with the needles harder than women.
I believe that.
I have some guys that just won't come back purely because of the needle standpoint, and which is kind of funny, but at the same time it's like, don't worry, it's a painless thing. I numb up the area and you're not going to feel anything. It could be a little sore the next day and everything, but by all means, we certainly try to make it as comfortable as possible.
Right.
Little ice and Tylenol, and usually it's a very well-tolerated procedure, yeah.
So, because me and Tyler do this podcast quite regularly, there are some days where we imbibe a little too much.
Yeah, I know. If you need to get the infusion going, we should actually bring some in here sometime and just, keep it going.
That'd be pretty cool.
But you guys do IV.
Yeah.
So is it just called IV fluids, or is it like
IV hydration? Yeah, we can, however you want to call it, but it is a IV fluid type thing, which is a different, there's a few different, I call them recipes, which is a combination of different things depending on what you're trying to achieve. If you're hungover, there's something for that, and that usually involves something that kind of controls some nausea. Really, you just need to be hydrated, but there's some like B vitamins in that, something for nausea. We can even give you a light, anti-inflammatory or pain medication for that, which is, it's not a narcotic or anything. Yeah. It's just, it's called Toradol. It's like ibuprofen.
Yeah. Oh, I've heard of that.
Yeah, just like ibuprofen. So, but then, a popular one for us is called Performance and Recovery, which is good for like a lot of athletes. So it's got different aminos, some B vitamins, some vitamin C. High dose vitamin C is a very popular thing these days. So, and then a mineral blend, kind of combine all those together. But IV hydration is really fun because you can kind of dial in specifically to a patient. We can go we have our standard blends or recipes, but if somebody's coming in looking for a certain thing, I can do a whole micronutrient panel and we can really dive into what you're missing. And then I can create a customized one for you if you really need to. So it's kind of like sky's the limit. And as long as it's done in a structured, safe way, of course, there's a lot of things to consider when we're kind of creating custom infusions, but it's very doable and it's fun because then people are walking out almost immediately being like, oh man, I feel a lot better. It's not just a hangover thing, but there's other, possibilities there. And the cool thing, so I don't know if it should be on the website, but something called NAD. So now we're talking about getting into sort of that's more like an anti-aging space, which is really where I want the practice to go, sooner than later. And NAD is a cofactor in our body that really drives cellular processes, and those levels decline as we get older. So you do an infusion of it, and sort of obviously the idea to replenish those, which would enhance those cellular processes and helps with what we call mitochondrial function, which is important for your energy and, cell and turnover and, how they sort of, cells always die and everything. And that whole process keeps carrying on, but it enhances that and optimizes that so that you can, kind of help from an aging standpoint. It's pretty interesting stuff. Yeah.
I know Joe Rogan's a big proponent of NAD. He talks about it a lot on his podcast.
Yeah. It's an interesting infusion. It's one that has you have to control how fast it goes in because it kind of gives you a little weird flushed feeling. It's very interesting. It's not in a bad way, but so you just control how quickly it goes in. So sometimes it takes a little bit longer to get that one fully infused. So it could be up to a couple hours. Some people are even longer, but it just depends on how it makes you feel. It's pretty interesting. It doesn't last. It's it's once the infusion's done, then you're good, but it's pretty wild. And so, like I said, high dose vitamin C is a popular thing as well. And we've got a lot of different other add-ons that we can do depending on what you're looking for, from like inflammation or, just general vitamin replacements like B vitamins and magnesium and things like that. And even some, infusions and injections, again, tailored more towards, weight control and fat metabolism and optimization. So B12 is a very common one, and we have a combination of a few things that focus on that as well. So
for one, like recovery, I guess you could say, let's focus on that one just because I'm thinking about it now. Is there someone that it's more tailored to that's like, okay, you're in the gym every single day and you're pushing a lot of weight, or could that benefit almost anyone who just relatively frequents the gym?
Really anybody. Yeah. I mean, It's not for sort of like just the hardcore gym goer. I mean, we all need, certain what we call essential amino acids. They are essential because we have to take them in. Right. And so, and a lot of them we can get in through our diet if we have a good diet, but a lot of people surprisingly don't. If they're trying to do something like, intermittent fasting or a keto-based thing, typically there's some nutrients that kind of get lost in the shuffle because maybe you're not taking in enough calories, which means you're not getting in the right nutrients, or it's sort of focused on just specific things like more of like protein and fat and everything like that. So you have to be careful. But, the point is, it's not just for like some hardcore athlete. I mean, everybody could benefit from those. I mean, mineral deficiencies like magnesium, for example, is a very common deficiency for all of us. And so, and we can measure it if we need to, or give a little bit and see how it makes you feel, but usually a lot of people start feeling pretty good, pretty fast when they get this.
It's really funny you bring that up too. The person we just had on before you is a mental health therapist in town. And she was talking about the deficiencies in magnesium and vitamin B as well.
Yeah.
So that this actually works really well together.
Yeah.
But my next question is that something, is it exactly what you're saying, using it to supplement? Like you can't just not eat those things, right? And just only get it through the injection, not the injections, but the infusions, right?
Sure.
Like it's not going to work the same, or could you? And just not the best way to do it.
best way is always through the diet.
Right.
Always through the diet. I mean, you want to encourage. I'd much rather have somebody be eating right and getting less infusions, to be honest with you, because that's a healthier way to go.
True.
But, based on stresses and activity level and all these different factors, it's definitely going to help you still, because just most of our lifestyles are geared toward go, go, go. And, a lot of us focus less and less on our own bodies. And I'm guilty of that too. And that's kind of part of why I got kind of passionate about it, because then I can sort of see how it even helps me. And, then it kind of helps shape how we can help everybody else. So.
Right.
Yeah, I'm just very interesting. I was thinking the same thing, like when it comes to like doing the infusions, like it makes so much sense, especially for like people who have a dietary restriction and are like, well, I can't eat this, this, and this, or I choose not to eat this.
Yeah.
So in order to get those like vitamins, like I understand taking the vitamin pills works, but I feel like every time I take those, I end up like pissing out like 80% of it.
Yeah. I mean, that's true. I mean, a lot of them are water soluble, as we say, which means you are going to get rid of what you don't need, but you can replenish it a lot easier through the IV. For sure.
So if I decided I did want to come in, do I need to be like an actual subscription patient if I wanted to get one of these infusions?
No, we don't have, not everybody is a, kind of a primary care patient of mine. I kind of welcome whoever, honestly, that wants to come in. So I have tons that just come in for the infusions, plenty that come in just for the aesthetic piece. And then some come in for one thing and end up, going down the rabbit hole of everything else. So it's sort of a mix of different things. And if you are sort of a concierge member, then you get discounts on some of those other services like IVs and everything. But no, you don't have to be. It's not that type of membership where it's that exclusive. You can come in the door regardless. Yeah.
Good to know.
So interesting. I'm just looking. I'm like, seems like something we'll end up doing sooner rather than later.
You guys should come in for sure.
Yes. I still have to find a primary doc.
We'll see. There you go.
Yeah. Emily's been yelling at me all year.
Yeah.
The past 5 years.
Yeah. Some, and that's common. I mean, some people are just looking for those routine physicals or labs or but again, there's still beyond that. We kind of feel like there's something for everybody there, even if you don't feel like it's not just about primary care. That is I was call it the foundation, but there's so much more that we can kind of dig into if we really wanted to. So really the focus is wellness, you feeling your best, feeling well. Wellness is sort of an umbrella term that means different things to different people. But again, it's really dialing in, and that's part of the question. What does kind of wellness mean to you? And let's try and get there,
Right, yeah. It seems like kind of touching on what a lot of the, I guess more specifically with the physical therapists that we've had on in the past are touching on is these aches and pains and the way that you feel and lethargy and stuff it may be normal, but it's not, or maybe typical, but it's not normal.
Sure, yeah,
so,
absolutely. No, I mean, it's not normal, and it shouldn't necessarily be the same. It's like, oh, we're just getting older, and that's how it has to be. I mean, it really doesn't have to be that way. There's nobody that really has said that that's the case, and there's nothing we can do about it. So, inflammation is another topic that is brought up a lot, more in the functional space, and you can look into a lot of different areas like gut health and gut inflammation and things like that are I'm sure have been talked about previously. I mean, there's such so much regarding our gut health that plays a role in even just how we feel mentally and physically. And so we can dive into that as well, kind of even do a full-on analysis everything going on there. It's
we should have just had Dr. Dobstaff and Buffy Andrews, who was the mental health therapist that was on, just be on the same podcast. We're touching on a lot of the same stuff. That's awesome. Like gut health and everything too. So these are
really?
these are perfect back-to-back episodes that we're having here. Didn't even try that on purpose.
That's funny. Yeah. Well, I don't know her, but I would love to meet her because I mean that's always something that we would probably end up going off on tangents for a few hours about it. But that's good. I mean, it's like that's really an important aspect of overall health and wellness that often does get neglected on that traditional route with depression and anxiety. Like, why are we really feeling this way?
Right.
Let's dial in a little bit further. So there's ways to do that.
So I have a question for you.
Yeah.
Talking about helping people be well and better in life, what would success look like for you? Like, because you mentioned you don't want to take on too many people at one rush, but like, what would success look like for your practice?
That's a good question. Success to me, I guess I'd have to look at that both just, maybe somewhat selfishly as a person, but
Absolutely.
also bigger picture as a practice. So I can kind of look at that two different ways. But success from a practice standpoint would mean, we're reaching the demographic that otherwise has felt neglected or kind of pushed aside, maybe from the traditional route, maybe from the functional route, I don't know. But feels like they have a welcome place to come and they're getting, sort of what's considered optimized care for them. From a, larger scale standpoint, I certainly envision this to be more than one location. And I feel like that would be a sign of, or a feeling of success to me for that. But on a personal side, success to me, I just feel like is more of, if we're asking ourselves the question of what feels the best right now, today, and that's just a mental and physical wellness question that I think we have to ask ourselves more often, because success to me is no longer is it a financial thing. There's still some of that. Certainly, we would all love to make a bunch of money, but I tell my kids this. I have 3 boys. They're 13, 11, and 8.
That's right.
And that's wow.
I was going to say, wild house.
That's right. And when I quit my job in the hospital, largely from, not only from COVID, I was working my way out anyway. But, in the middle of COVID, I tell them the story. I was like, I made more money, I think it was 2020, more money than I've ever made in my life that year. And it's not saying that to be arrogant. It's just, that's how it is, I was miserable doing it. I was absolutely just burnt out, run down, absolutely completely miserable. And that's when I realized that, that's not success, right? Because I had made all the money I thought I could make. And, or I was happy at, maybe I should just be completely happy because I just made more money than I ever made in my life. And absolutely miserable. So I essentially brushed that aside and, took the pay cut to do this, to kind of focus on what feels the best, and because I don't feel like I can deliver good care and focus on wellness if I'm not doing that myself.
Right.
And I wasn't doing that at the time. And so if I can, get some financial success out of that while blending those two, great. But that's never going to be the only aspect of it for me. So success to me means I can come home, I still have energy for the, the family, still have, energy on the weekends. And so that's my goal, is really to get that part of my life, on a true wellness path. And so I feel like I've made a lot of good strides really since I quit doing the hospital and focusing solely on getting this practice, it's on its own successful path. So,
yeah. That kind of plays in well with my next question then. So if you could tell your younger self one thing, what would it be?
Probably that. That money's really not the only aspect of success.
Right.
I don't think. And I was always kind of fixated on that for a while, just to be completely honest, selfishly. And my wife has been good about sort of redirecting me to be like, this is really not what it's all about. We can enjoy, there's so many other things to enjoy that you may be missing. Right. And so I would probably tell my younger self, to take a little bit of step back, relax a little bit, I think I still always would have gone into medicine for sure. But, changing the perspective a little bit and slowing down would have been a welcome thing to do.
Yeah, definitely.
Just interesting. That's my phrase for this season is interesting. Is there anything you would like to shout out social media wise or internet wise where people could find you?
Yeah. So our website's progressmedical.com.
Okay.
And we are posting a lot on, Facebook and Instagram typically. Instagram is Progress Medical ILM, and you can find us on Facebook as well. So we post a lot there. I'm doing some, different things through like WWAY and small snippets. I think we recently just put one up on the website. So there's some things to look there where I kind of talk much faster or more condensed about what we offer and what we do. But I think the main thing to understand, and that's kind of, we were posting a lot of different things. There was always an aesthetic thing, and then maybe there was an IV over here, and then, everybody's kind of like, what are you, Right. And so I really hope this helps kind of package it up a little bit better and tell, so people know that we are sort of a full service practice that can focus anything from primary care to even sick care to hormones and weight loss and functional aspects and IV hydration. Everything just kind of sort of built on, itself. And so to me, that's why I kind of have coined the term progress medical, because everything is sort of a moving forward and kind of changing and progressing. And so I, kind of look to keep doing that through the practice and seeing where the next, service or offering may be. So hopefully it continues to progress and grow and change based on what I feel like people need.
Yeah, that's great. I love it.
Thank you. I also want to thank all of you listeners for hanging out through the whole podcast. I just want to say, thanks. Like, comment, share, subscribe.
All the things.
We are literally on all of the things.
Yeah. Nice.
Yeah. Even we were on the app that was formerly named Twitter.
Oh, yeah.
At least I am. I don't know if Tyler's.
I'm not.
I think it's just funny that they changed the name.
We are on Threads, though.
Oh, yes, we are. We're definitely on.
Just because Instagram made me. But
if it's involved with Meta, we're definitely there.
Nice.
Thank you for coming on, Doc.
Yeah, thanks, guys, for having me.
Appreciate it so much.
This was great, really.
It was a blast. Check them out. Check out the website. And cheers.
Cheers. Thanks.
Cheers, everybody.